morning. My name is Adante Knight, and today I would like to talk to you about an issue that is plaguing not only the United States, but also many other areas across the world. Out of every 3 people across America is obese. An even greater number are considered overweight. Many children born into these families have a small chance to avoid the same fate. The questions being asked are, what is the issue and what can be done to change the outcome? There's just over 320 billion people that live in the United States. Over 100 billion of these people are considered obese. Just to put that into perspective for you, look to your right. Now look to your left. You and those people that you looked at, out of those 3 people, one of you would be considered to be obese. Obesity percentage jumps to over 40% in reference to those people who are poor. Once again, if this data were to be applied to this room, 2 out of every 5 people around you would be obese and even more overweight. There is a large-scale childhood obesity epidemic, especially concentrated in the southeastern region of the United States. Over 18% of children ages 6 to 11 are obese. 18.4% of children ages 12 to 19 are obese in the United States, and even more of these children are overweight. These numbers have been on a steady rise. These families in poverty do not have access to affordable, healthy food options, so they turn to fast food, which is fatty and unhealthy. These kids also have little access to exercise outside of school due to the lack of funding for athletics. It is known that supermarkets are found in more wealthy areas of town. Researchers from NYU Center compared prices of supermarkets and studied their effects on local children populations' diets. When a supermarket is introduced to an area, studies appear to show no change in the diet of the children that could now physically access healthy food in their area. This has led researchers to believe that they could not afford it. She and her colleagues studied 1,343 white, 55 black, and 128 Hispanic mother-child pairs through pregnancy and until the children were 4. They found that there are a number of risk factors for these children, which means that steps need to be taken in these areas effective for prevention. In the UK, around 60% of all adults are either overweight or obese. The obesity rate for children up to the age 19 is up to a staggering 25%. The Millennium Cohort Study tracks around 20,000 families across the UK. After 5 years old, the trend of the study showed that children living in poverty are almost twice as likely to be overweight or obese than those not. By the time they reached the age of 11, the obesity percentage was twice that of those who were best off. After observing everything from physical activity to diet, they have come to the conclusion that the best possible plan is early prevention to prevent mothers or fathers from passing down the bad eating habits. Because of these unfortunate circumstances, that those somewhere that they can purchase that doesn't lead them to being put out on the street. The solution is a health food market. This market will be stocked full of healthy food options, with most of these options being vegetables. The market will be a volunteer-based program which will require recruiting from not only the local areas, but just a general recruitment. The markets may start as open-air markets, but with donations they can be brought indoors and can stock the shelves. In the most poverty-stricken areas, a massive garden will be grown to supply the produce that will be sold in many of the stores of the area. With help of donations and sponsors, money will be raised to stock the refrigerated shelves with meat. Many may doubt the number of people who are willing to volunteer without getting a profit from the market. The center will be set up in these areas to advertise and draw in those willing to volunteer. Few will be needed for each market. Parents and family members can also sign up to work in the market in exchange for healthy food options. Many can't afford work and can barely put a crumb on the table. The profit made from the foods, however, will go towards the building of more markets. These markets will be focused in the hardest hit areas throughout the country. The centers for massive gardens will be decided upon by setting poverty lines. Where do we go? These markets will be focused. Areas below these will be first to receive the gardens. The poverty lines will be raised in relation to the areas that will receive the markets. With a gradual increase in the volunteer effort, this poverty line will include more residents and families. Those who work with the market will have access to free child care while they are away from home. Customers will also work for the Customers that work for the markets will be strongly recommended to have someone in their family, like a spouse, to try and find a job. This will establish a steady income. Health-conscious volunteer markets are the only way to reach out to the communities with healthy foods that can be kept at a low price. There are many food kitchens and other organizations that aim to feed the people. However, they do not offer a constant supply of healthy food that these people need. This is the aim of the market and hope for those in poverty. I would like to thank you for your time and hope you would consider my position.